Professor Ekström, Sweden has followed an unusual strategy against COVID-19. How is it going at the moment?
Well, it's going very well at the moment, actually. The curves in terms of critically ill and also deaths in Sweden related to COVID-19 have declined since mid-April, and the numbers are now very, very low. So, and the number of new cases is also quite low in comparison to most other countries in Europe. And those who are infected seem to be mainly young people who are not at risk of becoming seriously ill. And we think it's mainly related to a very rapid increase in testing.
Yes, these Sweden's new infections statistics look now much better than much of the EU. With fall approaching, do you think this trend is going to be sustainable?
Well, I think so. And I think that is actually the reason why we have such good numbers right now, because the strategy has always been more sort of sustainable in its approach, suggesting measures that are long-term acceptable to the population. We never had a total lockdown, but we've had some strict recommendations in terms of working from home. Higher education was also done at a distance, and social distance in terms of avoiding unnecessary visits to elderly, hand hygiene, those sort of measures that people, I think, have accepted to a very large extent. But it's possible to live with these measures. They don't infringe on your life and normal lifestyle too much. So that's why I think the support for these recommendations and the sustainability is so high in Sweden.
But your country's strategy had also a cost on people's lives. Authorities admitted that too many have died. Do you think that a total lockdown would have made a difference?
I don't think so, because the deaths we saw were very early in March and April, when the spread was probably already there. And it was mainly in special elderly care homes due to suboptimal working conditions, a lack of protective equipment, and also when we knew much less how to protect the elderly properly. But once health institutions and also sort of policymakers got a grip on this and sort of learned that this was really not a good thing, that we had so many, that infections came into these elderly homes and that so many people died in the first few weeks. And then things improved dramatically. So I don't think I don't think a lockdown after that would have had any impact, actually. It was mainly the routines in healthcare institutions.
Mm-hmm. But Sweden's strategy has been criticized by many doctors and experts around the world. Can you tell us how is the expectance rate in Sweden?
We have our public health authorities are making regular polls to understand how acceptable the Swedish strategy is in the Swedish population, and they receive very good results, actually, that 9 out of 10 Swedes agree with the Swedish strategy and have also changed their habits and sort of behaviors to adjust to the recommendations of social distancing, working from home, etc., to a very large extent. So I think that is actually the reason why we have such good numbers right now, that people support the strategy, and it is sustainable because it's something we can live with.
Mm-hmm. Your country still doesn't recommend, or it didn't make mandatory face masks, while in other countries they are mandatory. How do citizens behave now the numbers are better? Are they wearing masks, keeping social distance?
Some people wear masks, but very few. The large majority don't. Except for, of course, in healthcare institutions, as everywhere else. But social distance is kept, I think people do try to respect this, and I think that is the key to why we still have a good, a low transmission rate in Sweden. So that is still going on, and we might also have a higher immunity level in the country, which also contributes to the low spread of the virus right now.
Professor Ekström, is it safe to say that Sweden's strategy has succeeded?
I think it's too early to evaluate any strategy at this point. I think we might be able to do that next year, but I think we need to accept that we have to live with this virus for a very long time. And to me, at least, the focus should be to reduce the number of preventable deaths as far as possible and the number of serious illness among those most vulnerable, while completely stopping this virus from spreading around the world will be very, very difficult. And we need to balance the interventions we take against COVID-19 and this virus against all the other illnesses and health problems and social problems that we have to deal with in society, and make sure we strike a reasonable balance so that we don't put all of our focus on one disease and see a lot of negative consequences on everything else that we also have to deal with and make sure works in our societies. So I think a healthy balance and a sustainable strategy that aims at reducing preventable deaths is what we should aim for long term.
How close is Sweden to herd immunity?
We don't know that. I mean, we know now that everybody who have been exposed to this virus don't develop antibodies. So antibody surveys are not, it doesn't give us the whole picture. And we also know that it spreads in clusters. So if you do a cross-sectional survey, you may miss a cluster with very high antibody levels or a cluster with or an area with very low antibody levels. So it's hard to say, actually. But I do think it's fair to guess that we do have a partial herd immunity anyway, and that explains that the low infection rates that we have right now.
Mm-hmm. How optimistic are you about the vaccine?
Well, I think I'm impressed by the rapid vaccine research that has taken place across the world. And it does seem like we will have a functioning vaccine at least early next year. So I'm optimistic about that, but I don't think it's the only solution. The world can't wait for this vaccine to resolve all problems, and we'll have to distribute it in a fair way across the globe and prioritize those at highest risk of dying. But it's not the only solution. We need to find other sustainable strategies that is good both for COVID and also everything else in society that we need to think about.
Professor Ekström, thank you very much.
Thank you for inviting me.